So, welcome back on our session of YouTube Live. We are live on Instagram and YouTube both. So, you can start asking questions, and I hope everybody joins in early so that we can discuss a case or two and then try to answer your questions. So, welcome, Dr. Divyani. Yes, so there were few questions basically on WhatsApp group about lot of things, and one question which was very similar to a lot of questions asked on the YouTube group, on the WhatsApp group, was abusive. Can we have abusive children? And whenever you have this type of doubt that can you have this symptom or can you have that symptom, believe me, you can have all the symptoms which are written in the Mater Medica. It is just how do you perceive that symptom and how do you take that symptom out of the patient, or how is your case taking, it depends on that. I had a case maybe a few months back where the mother complained that my child treats me like, or even worse than a maid servant. These were the wordings of mother, that my child treats me worse than a maid servant. And if I ask something also to my child, little thing also to my child, he becomes violent in front of anybody. That was the complaint of mother. The child had a problem and he was very hyperactive and very abusive, especially to the mother, not to the father. And in course of treatment, I prescribed him hyoscyamus, and the patient responded very well to the treatment. And you'll be surprised, when there's abusive children, especially insults their parents, it is not always that we have remedies which have violent anger. Sometimes remedies like you have natromure also in that case, where the child is very abusive, and in that case, natromure is also written, ammonium carb is there. These are the remedies. Of course, chamomile is there, hyoscyamus is there, platina is there, lycopodium is there. These are there. But natrium and ammonium mur is there. And ammonium mur, I think I have told you before also, that ammonium mur basically are spoiled children. So whenever you have spoiled children, from the soric miasm only, they are so spoiled that they can do anything to the parents. So ammonium mur is from spoiled children. So welcome, Dr. Navjot. Best when to choose lower potency like 6 CH for constitutional. No, whenever you are prescribing for constitutional treatment, normally I start from 30 and then go in increasing order. And if the mental symptoms are very pronounced, I directly go from 200 to all 1M. It is said that whenever there is a gross pathological condition, in those cases, low potency is advisable, especially 6 potency. Yeah, welcome, Dr. Belwalkar. So this was an interesting one. I had a case. One case I had where the patient was so abusive. I had gone to visit that patient, and the patient was abusive, especially whenever there was a lot of pain to the patient. The patient complained about renal colic and there was a lot of pain, and with pain he used to be so abusive to everybody, not to parents, to anybody present in the room, and this was the case. And he had already taken some painkillers for renal colic and all. The patient was better but not getting better. In fact, I gave a simple remedy. Sometimes there are some rare remedies which basically are known for their common symptom but not for the rare symptom. So I prescribed the patient a simple remedy, Corallium rubrum. If you see the mater of Corallium rubrum, it is written that the patient is very abusive, especially with pain. So whenever there is pain and the patient is abusive, think about Corallium rubrum. I know Corallium rubrum is basically a remedy for whooping and spasmodic cough, especially where the attacks come very fast. That's Corallium rubrum. But in Corallium, this symptom that the patient is abusive with pain is very, very important. Do understand this symptom whenever you going for a visit or whenever the patient is complaining of a lot of pain. That is Corallium rubrum. Apart from the cough symptoms of Corallium rubrum, there is one or two symptoms of Corallium rubrum also, where the patient also has the same craving of salt as natrium. And in Corallium rubrum, if the patient is in habit of drinking, he will say after some time the beer tastes sweet. Those are two or three symptoms very rare symptoms of corallium rubrum which I've seen in my practice, and that's why I'm sharing it with you. So, abusive with pain, think about corallium rubrum. Your experience in treating joints pain after dengue, yeah. Uh, See, whenever you have condition, whenever you have symptoms where the disease has been taken place, and then the patient is suffering from joint pain. So there's a rubric, pain inflammation after. There is a rubric called as plain inflammation after, and then you have so lots of remedy. But you can there are some remedies which basically are I've seen in my practice very useful in clinical practice. You can always say that after exhausting acute disease or after acute disease the patient suffers from pain, then there are a lot of remedies. Whatever remedies I have used in my practice, I'll tell you. First is rustox, second is kali iode, third is rhododendron, fourth is sulfur, and fifth is arsenic. These are the major remedies which I've used in my practice. Of course, there are lots and lots of remedies which can be used. Go with that rubric: pain in the joints after inflammation or with inflammation after inflammatory disease, and you get these type of remedies. Welcome, Dr. Uh, Manish. I hope I pronounced the name properly. Yeah, Dr. Jyoti. Good noon. So these are the remedies which are useful. I have found in cases of either dengue, or you can say what you call corona, anything which lands up into this type of diseases. Then you can say pain in the arthritis pain or pain in joints after inflammatory disease. Then these are the remedies which are commonly used in my practice. Yeah, so the question on Instagram also. Yeah, there's question on Instagram. Maybe it is same only. So general, I would say Phytoleuca mother tincture worked in gynecomastia. Okay, very nice. So we have a very one clinical symptom, that is Phytoleuca worked in gynecomastia. And there are two types of Phytoleuca: Phytoleuca berry and Phytoleuca decantra. I hope you have used Phytoleuca berry, I think, for gynecomastia. That's nice. So this is a good clinical observation we have seen, and of course I have never used Phytoleuca mother tincture for gynecomastia, but if you have got good results, people can try in their practice. Next, so there was a lot of questions in case of fever. Okay, in fever, how to ask symptoms and how to prescribe in fever. Let me tell you, fever as it appears, sometimes it is not so easy as it appears. But in fever, there are 2 or 3 things which I found very useful in my practice. Ask the patient. Okay, Phytoleuca. No. I may be using it, but now since years I am not using it now. I used to use before maybe. So in fever, one thing I have seen in my practice, that ask which type. Ask the modality in fever. What does the patient do during fever? Either the patient becomes very angry, or the patient is very clinging to the mother, or the patient is lying absolutely still, does not want anything, or the patient wants the fan on, or the patient basically wants something to eat. At that time of fever, what are the symptoms of the patient? That is very important. That is basically differentiating the fever modality of the patient and the other modality of patient. So whenever you ask about fever, do ask at that time of fever how is the patient behaving. If the patient is behaving in a different, sometimes the parents comes and tells you, no, whenever the fever comes, we give one crocin, and he's better and he starts playing. Again he gets fever, again we give crocin and he starts playing. Ask him in fever what are the other symptoms in relation to thirst and other symptom which I have told you. This is a very important tip I have seen in my practice, that ask the patient what does the patient do at the time of fever. And you have patients who do not leave the mother's lap. We have patients who are very irritable and angry with fever. We have patients whose face become reddish and congested in fever. We have patient when the patient starts drinking a lot of water in fever. These type of symptoms basically, or the patient says lot of pain in the abdomen while in fever. So ask these type of symptoms, and you'll be able to prescribe remedies for fever. See, we have taken a lot of meteremedic on fever. Like we have remedies like arsenic is there, China horse is there, Jupiter perforatum is there, simple ferrum phos is there, limsipel. Lot of remedies are there. But what symptoms you are taking for prescription, that will define your constitution and define your patient. Yeah, welcome Dr. Almagir. So this is how you have to see about fever. Root of tongue near roof of the tongue near about soft palate feels very dry and painful. Get relief after having hot water or tea. See, whenever the patient comes to you and says that warm water is he's better by warm water. So if you see these type of complaints, there are two or three. Okay, the question has gone. Maybe yes. So the question is gone, but still, if the patient see what you can either take a particular symptom of that local part and take out the remedy, or you take a generalized symptom of the patient and then take out the remedy. Both are basically very advisable. If in my sense, basically I would say take the whole part. That is more important because it will define the patient constitution as a whole. Whenever these type of symptoms are there, you have to think about remedies like hippar is there, arsenic is there, Soranum is there, China Ars is there, and so these are the remedies which I have found very useful in these type of complaints. Arastox is there, CPI is there, Pulsatilla is there. Then there are a lot of remedies, but make sure that if there is dryness, then you have to define that dryness. So there are a lot of symptoms in the mouth in relation to dryness. That is more important because whenever the mouth is dry, most of the remedy will have better by drinking or better by wetting the mouth. But if the patient has dryness, now which type of dryness, when is the dryness, before eating, after eating, morning, evening, night? So there are a lot of other things, the dryness with thirst, without thirst, and that is important rather than I have seen importance of this hot and cold water, because whenever you sip something, the dryness is better in most of the complaints. So ask these type of defining symptom in relation to dryness. Especially I had a case where the patient used to say that I have dry tongue, and then when I differentiated the modality, told especially when there is fever I have dry tongue, and I prescribed the remedy bapticia. Normally bapticia is never prescribed, uh, see at the first instance. But if you have these type of symptoms, the dryness of tongue and fever, now this is a very very important defining feature of bapticia. Or the patient says that there's dryness of tongue without thirst. Now this becomes more important because as I said, sipping the water feels the patient is better, but still without thirst, then the remedy is a very important remedy. I hope you remember this remedy because this remedy has been prescribed so often, and it is a polygraph remedy like pulsatilla. The patient has dryness of the tongue without thirst. So if you are confused when to how to prescribe pulsatilla and you're not getting symptom of pulsatilla, do ask these symptoms of dryness of tongue without thirst. Pulsatilla is there, natramur is there, other remedies also there, but pulsatilla and natramur are very very important because these remedies are useful in we have used day in and day out in the practice. Welcome 7902. Candida after using antibiotics worse in the morning. See, whenever you have, as I always say, burning pain. Okay, as I in the morning, candida after using antibiotic in the tongue or in the mouth. So whenever you have these type of complaints, like for instance, if in homeopathy, if you see candida infection or any infection which is there because of usually a tongue. So any infection is there when using antibiotics. So whenever you are using antibiotics or whenever you are using any medicine which causes dryness of tongue or which causes, and especially worst in the morning, there are a lot and lot of remedies. And this is a wonderful question, because of late, because of the COVID infection, COVID virus, people have taken at random lots of antibiotics, and I have got these symptoms lots in my practice. And this Dr. Ellsworth has given a defining modality that is especially in the morning. So you can write down few remedies which I have found very useful, especially in the morning. First is opium, second is nitric acid, third is pulsatilla, and fourth is natramur. So natramur is not there. Opium, nitric acid, pulsatilla, and bapticia is there, and bratacarb is there, especially in the morning. And when the patient comes and tells you that when I wake up in the morning, I have this dryness of tongue because of a lot of use of antibiotics and medicines. There's a difference in the morning and waking. Waking, if it is there, think about 4 remedies which have got good results. I have most of the cases have shown good results, especially in the waking. The patient opens the eyes and there is dryness. Sulfur, opium, rustox, and pulsatilla have given me very, very good results. Of course, I had a case where after corona taking a lot of antibiotics, the patient had dryness, but it was especially in the night. And I prescribed in that patient a remedy Nux mosquita, which had given me very, very good results. A 3-year-old student, what should I do for now for doing homeopathy practice in future? Third year student. Yeah, so very nice, a very interesting question for all students. It is very important for you to first learn the basic mathematica, organon, and repertory. See, there are various theories, various modes of application of homeopathy remedies, various what you call schools of homeopathy. They will all help you, but your base has to be very strong. Because if you are following a particular school of thinking and if you are not getting results, you fall on the base. If a base is strong, you always have some support because you have been studied that base very precisely. So just be focused on the basic mathematica, the basic organon, and the basic repertory till you are a student, so that you can get a basic knowledge from the college teachers, from the college. That is very, very important. Don't just try to jump into something which is you find very interesting and forget the basics. So please read mathematica, the basic mathematicas, the book of organon, as you all know, and the repertory, whichever you write. Basically, we have been taught in school, and I think it's in college, the Kent repertory, Bojra Boningos in repertory. You can start using those repertories. First study those, and then when you pass out from your college, you can decide which school you want to believe, or which type of practice you want to do. Dr. Ekviya, welcome. Dr. Dunarkar, welcome. Dr. Saab, repentance about past mistake, especially about religious punishments. See, Dr. Akil, now repentance about past mistakes. Now, if basically the patient, try to basically get out why the patient is suffering from this, and you will be surprised. Most of the patient has, as you go in our mathematical and repertory, fear of salvation. The patient feels, I have done so many mistakes in life, what will happen to me? And there's always a salvation. He feels that now what will happen to me? Fear of salvation, and salvation. So this becomes a very, very important rubric. And uh, it is not what you call the patient was religious or was not religious, but salvation is a very, very important symptom. If you open your repertory, uh, you will find this rubric. In mathematics also, this is a very, very commonly asked. In fact, I had a patient where the patient used to say that it's a sentence in the mathematica. The patient feels that he has done an unpardonable sin and he has sinned away the day of grace and nothing will happen. So these are the symptoms you have in patient. Or for example, patient has a lot of anxiety about salvation. Then we have remedies like arsenic is there, lacasis is there, Staphylococcus aureus is there, sulfur is there, chiliodonium is there. So this is a very, very important rubric, a very, very important symptom. And do think about this symptom whenever you have these type of complaints. When we use the nosode, homeopathic nosode candida, no, I have not used the homeopathic nosode candida in my practice. See, there are a lot because I find that I get good results by using those polycrust remedies which I have studied. So I have not used this candida nosode, and there are a lot of other remedies, other nosodes which are coming up, which I have very sparingly used, but candida I have not used, so I cannot comment on that. Yeah, Dr. Karsyog, welcome. I hope I am pronouncing your name properly. Okay. So this anxiety of salvation, I was making a point that this rubric, or this symptom becomes important because at one point of time, if you see in case taking that the patient says that I have achieved everything, I have name, fame, money, but for that I have done a lot of wrong things, a lot of things which I should not have done. I don't know now what will happen to me after death, or what will happen to my children's. That fear of salvation and anxiety of salvation is very, very important, and that's how the remedy comes. So aurum metallicum is also a very important remedy in this case. So do think about this symptom, a very, very important symptom that you will find in your practice, and try to get these symptoms out of the patient, and you will get the symptoms. A left leg finger becomes very cold in winter in asthmatic. See, left leg. Now, I will not tell you. There are a lot of remedies. Now, basically, first you have to find out whether the patient is basically what you call, there is lack of animal heat, there is lack of vital heat, the age of the patient. These are very very important condition in case of if you want to prescribe these type of if you want to prescribe on this symptom. Just by this symptom, I think you will not get the remedy, but still I will tell you some of the symptom some of the remedies which basically have these type of complaints. Now we have written here especially left finger, left feet. Yeah. So we have to have that remedy where it is a remedy which affects the lower limb, especially the left feet. And you can write down the remedies. Of course, if you ask me, you have to ask more symptom than this. The remedies could be nitric acid, pulsatilla, sepia, sabadella, and caladium. Now, there is a symptom in homeopathy where it is written it is so cold, it is icy cold. Now, it would be your judgment, Dr. Pandey. It would be your judgment to take either icy coldness or just coldness. If there is icy coldness, think about sepia, agaricus muscarius, calcarea carp, and rhododendron, which I have used in my practice. But still, in case of asthma, ask few more symptoms before you zero down to this symptom if you want to prescribe. Yeah, Dr. Sachin, Sharon, welcome. Okay, so I hope you got some answers. You got something about this. And see, you have a lot of cold. See, in homeopathy, if you see there is coldness in the knees, hips, joints, fingers, lot of things are there. But make sure that before you prescribe, that has to be a very defining symptom of the patient constitution. That's very important. Otherwise, when you prescribe on this symptom goes, something other comes. So you then prescribe on that. It should not happen that way. And you can add in this camphor also and veratrum also. Okay. I hope you got some answers to your questions. Let's have some other question. Oh, it's already 3:25. Half an hour is very fast. Can we have some more questions fast? Instagram, I think few questions must have scrolled up because I was just answering few of the questions on the YouTube. I hope Dr. 7902, she got an answer, okay, of what to do in college, in school. That is what I think basically. Show us your clinic, sir, please. My clinic is situated in Sitabadi, Jhasrani Square in Nagpur. Okay. Yes. So, yeah. So I was just confirming that coldness part, and the coldness part basically, there are some remedies, where Dr. Kent has written lack of animal heat, lack of vital heat, and the remedy was alumina, and constitutional coldness, the remedy is kali ars. So either you prescribe on that particular part or you prescribe on the whole. No, that is also very very important in your practice. So if you read Kent's Mathematical, he has written the constitutional coldness, the remedy is kali ars, and patients or animal lack of animal heat, the remedy is alumina. Silicia is also there. So it's very important for me, if you ask me, in starting my practice, I have to see in particular parts, this part, this part, this part. Of course, if it is a very peculiar symptom, then take it. Otherwise, go for the grand symptom which describes the patient personality. That's more important. Yes. So can we go further with some few more questions? Yes. So there was one more question, there was one more question. There was a question where the patient had asked me something about the patient had an abscess on the face. Now see, whether the abscess is on the face or on the joints or on the limbs or on anywhere in the body, in homeopathy, one thing is very, very simple, that you have to have that abscess remedy, generalized abscess remedy, like we have hiparsal, we have mercury, we have sulfur, we have silicia. These are very common, or myristica, calendula. These remedy would be having their indication wherever the abscess would be, generalized. And if you get these type of symptom like abscess discharging pus or abscess discharging watery pus or very offensive, then you can differentiate. Welcome, Dr. Solanki. So these are the very, very important indications of homeopathy medicines where you can have a generalized symptom. No need to have particular that on face the remedy is different. No, but of course the access on face you can have think about one or two remedies extra with the all remedies of abscess. You can think about phosphorus also. You can think about kali iod also, and you can think simple remedy belladonna also. There was one symptom, which a lot of people ask that whenever the patient gets up in the morning, his face is bloated. मतलब जब भी सवेरे पेशेंट उठता है उसका फेस पूरा सूजा हुआ रहता है. Again, especially on waking, I think I have told you this answer in the last YouTube also. Especially whenever the patient gets up in the morning, he wakes up in the morning with swelling of the face or bloated face, think about spagilia and think about agaricus muscarius. This is very important. And I had a case where the patient told that there was a bloating of face. Whenever there is fever, there is bloating of face. Whenever there's fever, there is bloating of face. Can anybody guess the remedy? जब भी पेशेंट मुझे जब भी बुखार आता है ना तो मेरा फेस में बहुत सूजन लगती है. एंड दिस आर द वेरी वेरी इंपॉर्टेंट 3 मार्किंग सिम्टम्स ऑफ द रेमेडी, एंड यू मस्ट बी एबल टू डिफरेंशिएट दैट रेमेडी. एंड ऑफ कोर्स the patient complained with that was difficulty in urination and pain in the urination. Belladonna. Okay, I'm telling you few symptoms, and the patient complained about difficulty in urination, and there was too much pain when urinating. These were the symptoms which I took for prescription: the swelling of the face during fever with painful micturition, and excruciating pain when urination. So if you complete that symptom, belladonna will not come. Any other remedy? Anybody? Just I got the result, that's why I'm sharing. So sometimes what happens that the patient says some symptoms which are very, very unusual for that fever type, as I ask, and then you try to prescribe the remedy which is very, very prominent and very, very important in that symptom. So Matermedica, so repertory, then go to Matermedica, differentiate from the symptoms and get the remedy. So Dr. Poravo says belladonna, borax. No. Anything else? Lot of doctors online, so we can have some of the any other remedy. No, nobody. I did not give borax. I did not give belladonna because I don't know whether belladonna has the bloating of face, especially in the morning during fever. I don't know it has or not. Borax does not have. I know that belladonna could have, but the redness and the congestion was lacking. The patient suffered from pain while micturition, difficulty micturition, excruciating pain while urinating. Epismell, Dr. Magir says no. Epismell with the urination, the pain differentiates. It is no the stinging pain is there especially. I gave there are 2 remedies which are very, very important. That is Cilicia, and one remedy is Colorado. So when I got this rubric, I got these 2 remedies. Then I studied the urine symptoms, and that matched with Colorado. So I gave the patient Colorado 30, just 2 doses, and within 24 hours the patient was much better. If you have seen Colorado, it has this is basically the generic name. It has a different name. I think is Dorforia, I think. So it has a very, very important indication in urination. And if you see that remedy, Colorado, it has the same symptom as Cantharis, like difficulty urination, excruciating pain when urinating, and there is severe trembling of limbs also. That is Colorado. So I prescribed the patient Colorado 30, and the patient was much better. That's why when as I told you before, whenever in fever you are prescribing to a patient, it sometimes becomes difficult to treat the fever. Ask what happens at the time of fever. What is the patient exactly doing at the time of fever? And you'll be surprised that the patient will give you some symptoms which are so very different from what you thought. And that's the beauty of a Matermedica. All symptoms are such interesting symptoms and such beautiful symptoms shared by the patient and taken by the physician. And that's why it's important when you get the repertory, get the remedy, differentiate. If you basically see Apis mellifica basically symptom when I use Apis mellifica for fever, it is basically perspiration breaks out and the patient dries up very frequently. So there is a lot of perspiration and the perspiration dries up very frequently in fever. Then the patient is of epismel and the patient sleeps after the fever paroxysm. आप जब भी पूछेंगे, if you ask that parent of the child कि whenever he has fever, no, after fever he sleeps very nicely, that is epismellifica. Of course, the stinging pain is there. It's very nice. But these two symptoms are very, very important, that the perspiration breaks out and dries up frequently and the patient sleeps after the fever paroxysm. This is whatever clinically I have seen in my practice. In Mathematica, there are a lot of other symptoms, but I am just sharing you what I have basically seen in my practice. Okay, I hope you understand and appreciate the clinical basis of my prescription, because this is what I've seen and I'm sharing it with you. I hope you understood something about Colorado. Anybody? If you don't get results what I have prescribed, then it would be only a theoretical YouTube live. I'm doing it for the past now 2 years. It would be, I think I've crossed 100 also, but I'm every time I tell you something which I have seen in my practice and practiced in my OPD. So I hope you are understanding and getting some benefits in your practice by hearing this or seeing this YouTube live or Instagram live. Anybody? No, yes, no, 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 no from anybody? I think everybody is tired only in half an hour. Okay, so that was about fever. So I hope you understood something about Colorado. Dorfiro is, I think, the name of the remedy. And this remedy, of course, I have not used it very frequently, but sometimes, I told you these symptoms are important. For example, whenever you have then swelling, especially about the eyes, then you have other remedies. Then you have swelling above the eyes. So whenever the patient comes with bloating and swelling about the eyes, then swelling above the eyes and or swelling under the eyes, you have a lot of remedies. So in that case, it is very important to define that symptom, so that you're able to prescribe it properly. Tuberculum bacillum prescribing indications. Yeah, we'll do that Mathematica in the next YouTube, Dr. Sandesh, because I have already finished my half an hour. So I'll do that in next YouTube live, and I'll share my experience with that. So everybody, thank you so much for listening, and thank you so much for sparing your time with me. Thank you so much.